All right, so we're going to cover chapter 2, workforce safety and wellness. I apologize for my voice, it's just allergies. We'll get through this real quick though. It's a good chapter. It talks about your safety, patient safety, some things you can do to help keep yourself safe, some things that can help you with your mental and physical well-being. So we'll dive into it here. All right, so introduction. So to take care of others, we must take care of ourselves. Okay, so it's first and foremost is what we teach EMTs all the time is, BSI, scene safe, making sure that you're safe and you're well taken care of first and foremost, okay? EMT training includes recognition of hazards, so that's personal neglect, environmental and human-made threats, and mental and physical stress, okay? So this is being situationally aware and self-aware. All right, wellness is a state of complete mental, physical, and social well-being. A state of wellness must occur at work and at home. So, it's all fine and good whenever, we can put it on a slide and say, we're going to work on our well-being at home, we're going to work on our well-being at work, everything's great and fine. But we all know that, especially as an adults, that life has a tendency to throw us curveballs rather frequently. And so sometimes it's hard to get that balance of a good well-being in our lives. People are stressed, people are worried, whether it's financial reasons, spousal reasons, your kids. There's always things that are going to cause us to have some sleepless nights. Okay, EMTs often find work stressful. Okay, so we work in a stressful profession. We see things that most people would never fathom having to see. We deal with circumstances that no one wants to have to deal with. So we can definitely be put into some very stressful situations. Your calm manner will calm the patient, family members, and bystanders. One of the best pieces of advice I got, talking about skills, was mastering the ability to remain calm. And sometimes it's really, really hard. Everything around you is falling apart. You're on a chaotic scene. Your partner's falling apart. On the outside, you have to remain calm. Even if you're falling apart on the inside, on the outside, you got to keep that calm demeanor. Somebody has to be able to reel things back in from time to time. You must focus on personal safety, scene safety, including the safety of others, and patient care. Okay, so again, first and foremost, you're responsible for your own safety, getting home to your family, to your loved ones, to your dogs, your cats, whatever the case may be. And your partner's safety, you always need to have your partner's back. You both want to go home at the end of the day. That would, in my opinion, be something that would be career ending for me, have something happen to someone that I was working with, especially if it was something that I could have prevented, okay? And then after all those things are taken care of, we want to make sure we're providing good patient care. All right, so strategies to manage stress. And like I said, it's easy for us to put it in a slideshow and say, here's the things that you need to do. But we all know that sometimes these things aren't obtainable, or you can't just eliminate certain things in our lives. But I think the main thing to remember is figuring out a way in which to manage some of these stressors, ways in which that you can decompress, whether it's going fishing or sitting on the back porch reading a book or talking with a good friend or mentor, whatever the case may be. We always can't just eliminate things or make things exactly how we want, but we have to be able to manage how it makes us feel. So changing partners, in my career, I have had partners that are wonderful, and it made work so much fun. It made life easy at work. We just clicked. My very best friend was someone that I worked with for several years, my mentor into the EMS world. Like I said, we got to work together for several years, and then due to staffing shortages, we got split, and we both got put with some different partners. And the partner that I was paired with, it wasn't a good match, and it really can make work, not to say miserable, but it's not fun. You dread coming in some days at times. So there's times where you need to say, hey, this partnership isn't working out at work. I need to talk to my supervisor, see what we can do. Change your work hours. Some places all you have is 24-hour shifts. We're lucky enough here at JCAD that we've have the opportunity for people to move to 12-hour shifts at some point if they want to, work PRN hours, things like that. Okay, change the work environment. How do you do that? People ask. Well, sometimes it's hard. I don't know if there's a great clear-cut answer how you change the work environment other than taking personal accountability for yourself and your actions and behavior. Cut back on overtime. We always want to try to, I think most of us like to be the person that helps. We want to help pick up shifts, we want to help fill the gaps, things like that. But there comes a time where we all have to say, I've had enough this week. I need to take a break. I need to go home, see my kids, see my wife, see my family, whatever your situation is. Change your attitude. Maybe if you get up in the morning and you're dreading coming into work and everything is all negative about work and all you ever do is just, stay stuck on the negative, that's how your attitude's going to be. So maybe changing your perspective, talk to a good friend, talk to your supervisor, talk to someone maybe can uplift your mood about work and about life. Try to think about some positive things, find some things that you enjoy getting to do, whatever it takes. Talk about your feelings. You're on a bad call, be willing to say, hey, I need to talk to somebody about this call. You have something going on at home, that's affecting your work life. Say, hey, I need someone to talk to about this. We've got to get rid of the taboo that we don't talk about our feelings, that we don't need help in EMS, that we're bulletproof and can do anything. We gotta change that. Seek professional counseling. A lot of your EMS agencies nowadays offer employee assistance programs that will help pay for counseling. Some services out there, some counseling sessions are free to their employees, but most places have some type of resource to be able to help you seek some professional counseling if you so choose. Do not obsess over frustrating situations. I'm just as guilty of this as anybody else. Something frustrates you or just gets underneath your skin and you just let it brew and brew and brew. It just becomes this boil that you just can't get rid of. But we have to find ways in which to cope with those things and handle those things a little bit differently. But it's hard. Try to adopt a relaxed philosophical outlook. Some people just don't have that type of personality. Some of us can't just kick back in the easy chair and say, hey, life's great, and, living in Margaritaville, we're a little more high-strung, type A personalities out there that just can't kick back and relax. But you have to find a way in which to not wear yourself out, all the time. Expand your social support system. So whatever that means to you, whether you have a large group of friends that you rely on, you have a good family base you rely on, coworkers you rely on, church groups, other types of organizations, whatever the case may be, find some people that are willing to listen to you and support you and lift you up. Develop friends and interests outside of EMS. And I will tell you that this is hard. This isn't something that's just super simple, super easy to do. We get in this line of work and we start to meet people in this line of work. People in this field understand each other. We're able to talk about things, people aren't grossed out or, oh, I don't want to talk about that. They understand the shift work, they understand the stressors and the things that you see. So that can be hard at times. Some of your best friendships develop right within EMS, and that's not a bad thing. Minimize the physical response to stress. Again, this isn't something that's always that easy for everybody to do, but we need to figure out ways to have outlets. How do we eliminate some of the stress? What can we avoid to, get rid of some of the stresses in our lives? All right, so part of the wellness and stress management is eating a good diet. And I will tell you that I have eaten my fair share of quick trip hot dogs over the years, and some really crappy, fast food and things like that, just because you've been running all day and that's the first thing you get to stop and pick up to eat. So it's hard in this career field to always, have a great, exercise regimen and eat a healthy diet and do all the things that we know we're supposed to do. Sometimes the schedule just doesn't allow for it. Regular uninterrupted sleep. So, on your off days, when you're here at work, you can't dictate when you will or when you won't get a 911 call, but when you're off work, You need to make sure that you're getting a good night's sleep before you come back to work. Go to bed at a decent time, get up at a decent time, get some rest in your off time. Disease prevention, make sure you're always wearing your appropriate PPE when you're at work for whatever the circumstances you're dealing with are. And then balancing work, family, and health. Again, sometimes that gets hard to do, but reach out to people, reach out to others that maybe there's someone that has went through what you're going through, has been able to balance life out, and just can be someone to sit and talk to and explain your frustrations to. But figure out a way to try to do that to the best of your ability. All right, so infectious and communicable diseases. These are things that, especially in EMS, we can come in contact with quite frequently, and there's times where we never even know that we did. So that's why it's always so important. We stress to our EMTs, be as high and safe. Always make sure you're wearing appropriate PPE. Whether that's just a pair of gloves, whether that's goggles and a face mask and gloves, or you add a gown to that. Whatever the situation is, make sure that you're wearing appropriate PPE. Okay. All right, so some routes of transmission. So you can get direct contact. So you directly come in contact with something, you touch it, you get it on your skin, things like that. Indirect contact, airborne transmission, that's the sneezing, coughing, droplets floating through the air. Foodborne transmission, that can be, like your E. coli, stuff like that, eating bad food, getting food poisoning. And then your vector-borne transmission. Okay, so some things you can do to reduce your risk: proper handling of bloodborne pathogens. So disposing of infectious waste into appropriate containers, making sure we're putting our sharps into closed sharps containers, making sure that we're wiping down the backs of our trucks with the appropriate cleaners. CDC standard precautions is appropriate PPE, patient care environment. So, making sure our patient care environment remains clean, our cots clean, our monitors clean, anything that comes in contact with the patient is kept clean. And then there may be times of special circumstances, as like right now with COVID. We've changed so much about the way in which we go about using standard precautions with COVID. So, and that's a whole ball game in itself. So good hand hygiene. Out in the middle of nowhere, you're on a call. You don't always have soap and water handy to be able to wash your hands really well, but you do always have some alcohol foam or hand sanitizer in the back of your ambulance. Make sure that you're using that, and then as soon as you get back somewhere, make sure you're using soap and water. Get your hands real good and clean. Gloves. So, nitrile gloves are pretty much the standard anymore. People don't carry latex or vinyl much. People are allergic to them. So we have nitrile gloves on our trucks. They're always readily available. Wear gloves. Every patient encounter, you should be wearing gloves. That's just common sense type things. Every patient encounter, at the minimum, requires that you wear gloves. Removing gloves, so doffing and donning. We'll cover that, more taking gloves off and putting gloves on. People are like, oh, it's just taking a pair of gloves off. Well, you can go to take a pair of gloves off and doing it improperly. Those things are quite elastic. You can sling whatever's on the surface of, the hand surface of your gloves all over, the people around you or the back of the truck. So making sure that we're being mindful when we're taking off our gloves to dispose of them is important. All right, so eye protection. So like right now, you see most of our folks running around. Safety glasses are required. Goggles have become a big thing, especially with COVID recently. You go into the ERs and most all your ER nurses are wearing goggles their entire shift. Prescription glasses are not adequate. Face shields also, you probably went into, or you may go into ERs and see a lot of nurses wearing face shields and potentially goggles underneath the face shield with their mask. So just depend on the circumstances and what people have readily available to them. Gowns, so gowns kind of provide a, not a full body, but large body surface area coverage. With COVID currently, we're wearing gowns on any patient encounter with someone that's COVID positive, but there may be other circumstances, bloody scenes, patient covered in vomit or feces, those types of things. We want to try to protect ourselves and wear gowns. All right, so masks, respirators, and barrier devices. So the world of wearing a mask has changed. At the minimum anymore, we're wearing surgical mask or procedure mask on every call that we go on, wearing N100 respirators on any respiratory precaution type calls. And then nowadays you're even seeing PAPRs, which is a full hood connected to a ventilation system. Supposed to, be kind of more of a complete protection almost. But we're living in a world of masks and respirators currently. All right, proper disposal of sharps. We always want to make sure that we dispose of sharps in appropriate closed sharps containers. No recapping, no breaking, no bending, none of that Johnny and Roy sticking the needle in the bench seat cushion kind of thing. Sharps need to be disposed of in appropriate containers to protect you and your patients from needle sticks and potential infectious disease contamination. All right, so your employer's responsibility. So your employer is responsible for providing you with appropriate PPE, having an infection control plan in place, making you aware of the hazards in which you may come in contact with on the job, and how you go about reporting any kind of exposure. So that's your employer's responsibility. Make sure that you have all that information readily available to you. So this is a personal obligation to yourself and to your patients and your coworkers that you have some type of routine every day. Cleaning the ambulances in some of your departments, it's a policy, that you go out and ride with or eventually work for. It's going to be a policy that the ambulance is cleaned on a daily basis, disinfected, UV lights are used and ran, just depending on the circumstances and the service and the way in which they go about it. But there should be some type of infection control routine that takes place every single day. So immunity, even if germs reach you, you may not become infected. You may be immune. So I always like to say that those folks that work in EMS have, if it's out there, we've probably been exposed to it and have no idea. But you have to be mindful of these types of things, especially during flu season with COVID. A lot of this other stuff, there's stuff even that's new all the time that we don't even know about. So make sure you're always wearing your appropriate PPE. Make sure you're taking care of yourself. Maintain good personal health, and then get your immunizations if you so choose. Here we offer hepatitis B and hepatitis A, varicella, titers, tetanus shots, all your standard vaccinations to our employees. Flu shots every year, things like that. So I always recommend if you're comfortable with immunizations, that you get them to help protect yourself and your coworkers and your family. All right, so post-exposure management. So if you're exposed, depending on the incident, you may need to turn patient care over to another EMS provider. It may just be that you get the patient handed off at the hospital. You need to contact, your supervisor, things like that. But make sure you clean the exposed area well. Get something in your eyes. You need to rinse your eyes thoroughly for an extended period of time. Call, depending on the department's infection control plan, you need to call whoever's in charge of that. Get them notified that you've had an exposure so that they can start the ball rolling on their end. Most employers are going to ask you to complete an exposure report so that way they can follow up. Because chances are they're going to request of the hospital to do a lab draw on that patient. Make sure that there's nothing that they're a carrier of that you potentially have been exposed to or will come down with. All right, so scene safety, begin protecting yourself as soon as you're dispatched. So we talked about in chapter 1, your scene size up and, getting that picture of the scene in your mind starts at the time that you're dispatched. At the same time, you also need to be thinking about any hazards that you may come in contact with. Depending on what you're being dispatched to, your scene safety concerns should start at that time, okay? And then continue to protect yourself once on scene. So, hazardous materials, electricity, fire, vehicle crashes, all of these things can be something that we are going to potentially come in contact with at some point in time. Hazardous materials, we're going to have to call out a hazmat team. We should be far away from those scenes until they're deemed safe. Electrical lines down, we need to make sure we're notifying dispatch and keeping people away from the scene and safe. Fire department, if we have a fire, we'll make sure the fire department's in or out. Vehicle crashes, there's always things that can be a hazard, sharp corners, extrication equipment, just depends on the scene, but always need to be mindful, have your head on a swivel, be looking for all those things that could become a hazard to you, your partner, or any other person on those scenes. Okay, so protective clothing. So cold weather clothing, turnout gear, or most places, EMS agencies have extrication gear, so gloves, helmets, boots, eye protection, ear protection, skin protection. It's funny they mention ear protection here. That's kind of becoming a huge topic in the forefront out there about EMS providers and hearing protection. Years ago, our ambulances weren't as insulated. A lot of hearing loss deficits you're starting to see in a lot of your EMS providers. I know me personally, my hearing is not very good. Those loud sirens and those ambulances for years without insulation can really start to wreak havoc. All right, so caring for critically ill and injured patients, so let the patient know who you are and what you're doing, okay? We should never be going up and putting our hands on a patient without making them aware, hey, I'm so-and-so with Johnson County Ambulance, I'm here to help you, that you're attending to the patient's immediate needs. Is there any life threats that I need to address? That's always first and foremost. Is there a life threat that needs to be addressed? Okay, so responses of the critical patient, they may be anxious, have pain, be fearful, anger, depression, dependency, guilt. You could be dealing with a whole host of emotions, so you have to be prepared for that at all times and for those emotions to shift drastically at any moment. So communicating, avoid sad and grim comments, orient the patient to you, why you're there, what you're doing. Be honest, don't lie to these patients. Allow for hope, locate and notify family members. It may just be as simple as, hey, what's your wife's phone number? Do you mind I'll give her a call, let her know where we're going, okay? So with children, if you have a responsible adult that can accompany the child, you get in situations where mom and dad were in the front seat and kid was in the back seat, involved in a motor vehicle accident, and mom and dad are both hurt, you may be the only person that's gonna be able to go with that child. It's just you in the back of an ambulance. So you need to be able to get down on the kid's level, be able to talk to them, reassure them, deal with all those different age groups that you may encounter, because all of them are a little bit, different from one year to the next. Children interact differently, so that may be something that you find yourself in a situation. The death of a child, it's a tragic event. You want to help the family in any way that you can. So there's never enough training or words to be said to describe the scene of where a child has died. Dealing with the anguish of parents, family members, fellow responders. This is a truly, I don't think, tragic event really starts to cover it. This is a call that you're gonna need somebody to talk to about it later on, especially if you have children of your own, nieces, nephews, godchildren, whatever the case may be. You're probably gonna need someone to talk to. If you get into one of these circumstances in your clinical rides, we're absolutely gonna have a conversation about how you feel, what you saw, those kind of things. Make sure that you're doing okay. So this is hard for anybody. Doesn't matter if you've been in this career field for 5 minutes or 15 years. This is something that none of us ever want to have to run or experience. Okay, so death and dying. Death may occur. Can happen quite suddenly after prolonged terminal illness. So we have a tendency to deal with patients that are on hospice care. We go out and are asked to come out to confirm death. A lot of times those families have been prepared for this to come, but sometimes, as much as they think they're prepared, they're not quite prepared and it hits them. And so you may be dealing with all kinds of, emotional distress on these scenes. The EMT will face death. it will happen in your career. You will either, see a dead body, work a cardiac arrest, resuscitation that is, that you can't get them back. Maybe a motor vehicle accident where they're dead on arrival. Someone dies right in front of you in the back of your ambulance. You are going to come face to face with death at some point in your career. And it's hard, and especially depending on the circumstances at times, it can be very, very stressful. So, any time that we have providers that are struggling with these types of events, we need to be talking about it. So some of the stages of grieving that you may encounter, so denial, anger, hostility, bargaining, depression, and acceptance. And there's no rhyme or reason to which order you may encounter someone or you yourself may go through these stages of grieving. So you have to be prepared for anything from one moment to the next with someone that's in that grieving process. So be empathetic, be mindful, be professional, be respectful, and do the best you can to help people in their moment of need. So as the EMT, ask how you can help. It may just be that they need you to sit there with them. Just sit here. Can you just sit here until my family member gets here? Absolutely. Reinforce reality. That's why I say we use terms like they have died, they are dead. No, well, this, that, and the other terms that can be very vague. We need to use direct terms that make it very clear what we're talking to them about. Be honest. Don't lie to these people. They're already grieving. They've already experienced a personal tragedy. Be honest with them. Allow the patient or family to grieve. Let them go. Their grieving process is going to start right in that moment. Depending on the person, depends on where they'll start, but allow them to start that process. Be there, be empathetic, be professional and respectful, and do whatever you can. Okay, so things you don't say. Give it time. Things will get better. You should not question God's will. You have to get on with your life. You have to keep on going. Things like that. We don't need to be saying that to patients or family or a fellow coworker. Like I said, learn how to be empathetic and how to talk empathetically to people. I'm sorry for your loss. It's okay for you to be angry. It must be hard to accept. That must be painful for you. You don't have to be able to put yourself into their shoes or into that specific incident to be empathetic and to just have some concern and just general care for whoever it is that you're encountering. All right, so stress management on the job. EMS is a high-stress job. And I can't stress that enough. This is not an easy career field. There's nothing about it that just makes it easy. You work hard, you work long hours. Sometimes you work long hours for little pay. You're a public servant. You're always trying to give back to the career field. It can become very stressful at times. It's important to know the causes of stress and how to deal with the stress. So if there's something that you can manage and control, you should do so. General adaptation syndrome, so alarm response to stress, reaction and resistance, recovery or exhaustion. So at some point, everyone's going to get to their breaking point. I've been there over the years where I'm just like, I can't do anymore. I've had enough. I had even a meltdown a time or two. Just I can't do anymore. I'm exhausted. All the crappy things you deal with and see kind of start to catch up with you. It happens easily. So some physiological signs of stress, so increased respirations and heart rate, cool clammy skin, dilated pupils, tense muscles, increased blood glucose levels, you're perspiring more than you should, decreased blood flow to gastrointestinal tracts, you start to have a lot of stomach problems, GI problems. If you're starting to experience these types of things, you really need to step back and self-evaluate what's going on in your life, what's going on at work, and probably go see your doctor about some of this stuff. Figure out what you need to do to get yourself back in the right place. All right, so some of the stressful situations we encounter in the career field, dangerous situations. There's always going to be times that, we could very easily get ourselves into some dangerous situations. I can think back over the years to several that it's like, well, that was stupid that you did that. So those things are out there, and you never know when you're going to walk into one. Physical and psychological demands, they're heavy on the EMT and paramedic. They're very, very heavy at times. Dead or critically ill, injured patients. I said you're going to come face to face with death at some point in this career field. Overpowering sights, smells, and sounds. I will tell you that you don't really think about it, and we will have a night later on in the program where we do a sensory overload night, and I think until you're in that situation or you're put into that training scenario, it's hard to really understand maybe what that's talking about, but your senses become overwhelmed and you can't think straight. You just can't hardly function, and it becomes hard to remain calm, to remain competent, and provide good care. So we'll really kind of delve into that later on in the program. Multiple patient situations, so that more your motor vehicle accidents, MCIs, you have patients everywhere. It's going to be stressful as a light word. Angry or upset patients, family, or bystanders, you're going to encounter that at some point as well. And being the one that can remain calm and professional and respectful will go a long way. The unpredictability and demands of EMS. You never know when the tones are going to go off, and when they do, you never know what you're going to get, and it may be at 3 o'clock in the morning. So it's to say that it's unpredictable and demanding can be an understatement at times. All right, so stress reactions. So an acute stress reaction occurs during a stressful situation. Delayed stress reactions manifest after a stressful event, and cumulative stress reactions, prolonged or excessive stress. This is where a lot of folks in EMS, this is where we start to see the PTSD starting to really rear its ugly head, is that cumulative stress reactions. They just shove stuff down, and eventually there's no more room to shove. Okay, and again here is the PTSD. Talks about critical incident stress debriefings. This is something that I feel like as EMS as a whole, we don't do real well all the time. Something that we could definitely do better at. But basically what these critical incident stress debriefings should do is bring in, a crew works a bad call. You bring in the crew with a supervisor, a counselor, whatever the crew needs, sit down and maybe talk about the call or whatever the crew needs at that moment. That's what those types of incidents should do. And like I said, as EMS as a whole, we need to do a better job with things like that. Okay, so some warning signs of stress: irritability towards coworkers, family, and friends, inability to concentrate, difficulty sleeping, increased sleeping or nightmares, feelings of sadness, anxiety, or guilt, indecisiveness, loss of appetite, loss of interest in sexual activities, isolation, loss of interest in work, increased use of alcohol, recreational drug use, physical symptoms such as chronic pain, and feelings of hopelessness. And I could sit here and check several of those boxes on there that I have felt over the years. And I know, that I'm stressed. I know that things aren't going right, but it's how in which you deal with it. And for a long time, I wasn't real good at dealing with it. And there's times even now I'm not real good with dealing with it. But this stuff will sneak up on you, and it can become bad enough that it just stops you in your tracks, and it forces you to do something about the stress at work, the stress at home, whatever it is. Life has a way of just saying, nope, you're not going to do this anymore, and we're going to reset. So always make sure in those stressful situations you use extreme care in words and actions. So, once something's said, you can't take it back. When something's done, you can't take it back. So remaining calm, polite, respectful, and professional is always a must. Even in the most stressful situations, someone's in your face calling you names, you have to remain calm. Bring a sense of order and stability to the situation. Sometimes you are the voice of reason. Patient's reaction is influenced by many factors. Allow them to express their fears and concerns. Talk to them. Let them know why you're there. Let them know what you're doing. That you're there to help them, that you're there to take them to the hospital. Be reassuring. Transport parents with their children if at all possible. You separate mom and baby from each other, that becomes a whole stressful situation all in itself. So if at all possible, keep parents and their children together, or if you're transporting a child, take a parent along with you. All right, so violent situations. These can be created by civil disturbances, large gatherings, domestic disputes, crime scenes. These are the types of scenes that law enforcement should secure the scene before we ever enter. Do not disturb crime scene evidence. So if you know that you're on the scene of a crime scene trying to treat a patient, we don't want to cut through the bullet holes on the clothes. We don't want to disturb things around us as much as we can. Things like that we have to become mindful of to our surroundings. So behavioral emergencies, the number of calls that we run related to psychiatric and behavioral emergencies has increased drastically over the years. It's something that has become extremely common. Do not have a clear physical cause and result in unusual behavior. So this could be anything from your manic bipolar patients, schizophrenia, some kind of personality disorder, suicidal patients, homicidal patients, young, old, middle-aged. Anymore, you never know what you might get yourself into. So if you feel the scene is unsafe, you feel like the patient you're responding for it's not safe for you to enter and interact with that patient without law enforcement, you need to get them en route. All right, so some workplace issues that you might encounter. So cultural diversity, so communicate in a respectful way. That just goes back to the treat others the way you want to be treated kind of thing. Just because you don't agree with someone's, political thoughts or religious thoughts or whatever the case may be, doesn't mean that you can create a hostile work environment just because you don't like someone or agree with someone. We have to be respectful of each other's opinions. Sometimes you're just gonna have to agree to disagree, and remain professional. Sexual harassment, you got your hostile work environment, hey, if you do this, I'll promote you to this kind of thing, offering to pay them for, something in order to get promotion. That kind of stuff will get you in hot water real quick. All right, so substance abuse, seek help or find a way to confront an addicted coworker. So I will tell you that, over the years I've seen EMS professionals that have went down this terrible rabbit hole. And if they just would have asked for help sooner, things would have turned out a lot differently for them. So if it's something that you start to have trouble with, you need to reach out to someone, get some help. Suicide prevention, there's all kinds of things out there. Like I said, most employers have an employee assistance program, can help get you counseling. There's the Code Green campaign. You can follow them on Facebook, get online. They have a lot of mental health resources. There's so many things out there that can help prevent EMS and first responder suicide rates. It's become staggering. Every year it goes up and up even more. So if you're having issues, you're depressed, you're having those thoughts, please reach out and get some help. There are all kinds of help available. People will be willing to listen to you and get you help. Illness and injury prevention, many EMS departments have established some programs that handle that. Your department should have those programs in place. You need to make sure that you take a look at those policies and procedures and be familiar with them. Okay, so we're now to the review questions. So this would be a great time for you guys to get into JB Learning, pull up the slides and go through these questions and answer them as a good review for your quiz for this chapter. So I'm going to stop the slide presentation here. Like I said, get into JB Learning, pull up the focus slide lecture, and go through your review questions and answer them, and then get your quiz taken. Have a good day.